Hello, hello Facebook world. Welcome back to another live Q&A. It feels like it's been a minute since we've been together. I hope all of you had a restful Thanksgiving break and you're back refreshed and ready to ask questions because we've got a great topic today, a timely topic today. And so I'm really excited. If you have been a part of one of our Facebook Live events before, I would like you to throw me some heart emojis. Let me see them. Lisa Chin, I see you. Thank you for being here. Throw me those heart emojis, folks. Yes, I see you. Thank you so much. Cami, thank you for sharing. Perfect. All right, if you've never been a part of one of our Facebook Live events before, give me a thumbs up. Let me know that you are excited to be here and that you are going to be here to ask questions. Thank you. I see you joining. Yes, 31 now and more. Alliance Mental Health. We're here to be taking some of your questions. A lot of you know because we have it in the ILP. Do you want your kiddo to have some counseling services? And we've got the folks who are providing those counseling services here with us today. We have got Ron and Candy on the line. Guys, thank you so much for being here to help me answer questions from the people who are here to hear from you. Ron, who are you and how long have we had this partnership with Epic going?
Hi, happy to be here. My name is Ron. I'm the CEO of Alliance Mental Health, and we've been a part of Epic Charter Schools back when they were about 5,000 students enrolled. So 5 or 6 years, I would guess. But most recently, we decided to partner with Epic in a bigger way. And this has been about 1.5 years ago where we decided to improve our virtual capabilities, and thankfully so, because now in COVID we're extremely busy.
No doubt, I could only imagine. And Candy, tell me who you are and how long you've been with the company as well.
Hi, I'm Candy. I'm a licensed professional counselor. I am the Chief Clinical Officer here for Alliance. I've been with Alliance since the beginning, since it was created. Ron brought me over from a previous agency that we worked with.
Perfect. Thank you. And I see you guys joining. Thank you so much. Holly, Douglas, Katrina, Taryn, Bailey, Stephanie, Rosie, Justin, Lisa, Nicole, thank you so much for being here. Thanks for giving us those thumbs ups and those hearts. We are really excited to have you. So if you have a question, don't forget to type it in the comment box and let us know how we can help you around this conversation. Guys, December is one of those times where you start really hearing about mental health and taking care of yourself and loving yourself. Why is it that this time of year, Ron, answer this for me. Why is it that this time of year we really start hearing questions and talk about mental health?
Well, it's a stressful time for some families and some children. And, I think this time towards the end of the year really kind of brings things to a close for 1 year and begins another. And I think, to be honest with you, whether it's the family stress, the traveling, the money that we have to, try to come up with to buy Christmas presents and other things, maybe travel, that typically just puts a lot of pressure, I think, on families in general. Some families just simply can't afford to have nice holidays or buy their children gifts and things. So I think there's that, and I would also like to invite Candy, the Chief Clinical Officer, into this answer because she really knows the details of this.
Yeah, like Ron said, it's a lot of fear of not being able to continue to do the traditions that you have previously done, especially right now with COVID. I know we're focusing on the month of December, but particularly this December, it's really hard because you're used to having large family gatherings. That's not happening. Just trying to figure everything out. For adults, we get a lot of referrals for adults around this time, especially because there are so many of us that don't have family or are estranged from our family. Family members have passed, and it's just really hard to struggle with those memories and not being able to meet those typical traditions.
So true, so true. Well, let's dive in. I know we've had some questions that have come through our live chat, and I know you guys have had, quite a few probably frequently asked questions. The number one question is, how do we sign up? I think my child might need mental health services. How do we get them signed up for this?
I'm not sure if I'm able to speak to this or if we're both on. I apologize. But it's easy to sign up for services. You can do that through the Epic Charter Schools website. There's a drop down in there for students and parents, and then it'll be under the behavioral health services tab. You can request that. Teachers can also submit that, or staff can also submit for the services. And then additionally, if you can't figure out the Epic Charter School, you can go to alliancementalhealth.us and submit a referral or request an appointment on there.
Perfect. And we've got a question coming through. When we went to sign up, it said YCO Alliance. Is this the same company that we've been partnered with for, some time?
Yeah. So YCO Alliance is one of our trade names. The company has evolved from Youth Care of Oklahoma to YCO Alliance, and then we dropped the YCO component because we're now providing services in a much broader way beyond just the youth of Oklahoma. So we see all ages, and we specialize in several other things. So we felt it better to be called Alliance Mental Health.
Perfect. And is this a free service that you're providing?
Yeah, it's a free service. So the founders and I sat down a couple years ago, as I mentioned previously, and they asked me, can we do something where the service would be free to any student in Epic Charter School? So we figured out a way to do that. And probably like everything else, I mean, there's a little bit of a misunderstanding when it comes to free. Free just means it's at no cost to the Epic students. We still ask for insurance information so that we can bill the insurance. Whatever we get paid from the insurance companies is used to compensate our therapists and our medication management providers.
Awesome. And so Katrina is asking, are there any tips, and maybe Candy, you help us with this one, are there any tips for parents to help with mental health when doing homeschool virtual this pandemic? And Katrina, I don't know if the question is for you personally as a parent or helping with your kiddos, because I know that this has been a huge disruption to kiddos' lives as well. Katrina, Candy, do you have any tips for Katrina on how to help kind of stabilize and adjust to this pandemic lifestyle?
Mm-hmm. Just making sure you have one-on-one time with each child is very important, and making sure the other siblings are not involved in those conversations. We've had a lot of people ask, how do I talk to my daughter about her depression because she's struggling? And the most important thing is giving them the ability to talk to you and to open up about what's going on, and making those conversations be open-ended, and just asking them and showing them how you actually care about what's going on in their lives and what they're struggling with. It's very important.
Thank you. And you just said something that hit me pretty close to home. Whenever I would say 12 or 13, I remember being in this place mentally with my schoolwork and just different things that were going on. And there was the last person I wanted to talk to was my parents, because I thought I was going to get in trouble for the schoolwork issues that I had mounting in top of my head. How do maybe students reach out to you, or do they need to have that parent reach out?
It's not necessarily a parent. A lot of issues that we've noticed with parent-child, especially, again, talking about teenage girls, is that they don't feel comfortable going to their mom, but they may have another adult, like their teacher at school, the school counselor, a stepmom, an aunt, a best friend's mom. They just might be more comfortable reaching out, talking to someone else. So it's very important for the parents to remember to not get upset if they find out their daughter is finding someone else to talk to. Also,
Awesome.
I believe. Yeah, okay, good.
No, go for it. Tell me more.
Oh, okay.
I don't want to interrupt.
So we do have the laws around mental health in Oklahoma is that the parents do have to be aware. A child cannot seek services unless they're emancipated, if they're under the age of 18, without the parents' permission. So a child can reach out to us, but we will have to make contact with the parent.
Awesome. And Ron or Candy, either one of you jump in, or maybe both of you jump in. How can parents ask questions of their kiddos? I mean, sometimes we are busy and we're dealing with our own stresses right now. What kind of questions can we ask our sons and daughters that we need to find out if they may have issues that they're not coming to us with?
That one can be tough, because usually teenagers typically aren't forthcoming with their issues, but you can notice something. The biggest thing I encourage is asking them if they would like to speak to somebody. If they're not comfortable, just be open and honest. If you're not comfortable talking to me about your issues, would you like me to seek some counseling to see if you can get somebody to help you out?
That is good. Ron, did you have a follow-up?
Yeah, I actually did want to follow up on that point. It's top of mind for me because I just about an hour ago had a conversation with my 16-year-old daughter, and she was asking me about why do I need to get back, to the house, and why are you doing a Facebook Live event? And I told her, a relationship with Epic Charter Schools, and she knows, of course, that we're in the mental health field. And her initial understanding about mental health was she was a little taken back that there were that many people that were receiving mental health services. So I think it was a complete misunderstanding for her as far as when should somebody reach out? Like, what kind of things do these students deal with where they need to talk to somebody? And so I came up with just a couple of simple questions, that I was posing to her about, do you have any friends that are struggling right now at the end of the school year, COVID, online schooling, friendships? And, if that's getting bottled up, the therapists are going to find out and help you find out why that is and how to better cope with that. And I said, so everybody actually could probably use some assistance with getting through these tough times and making sure that we're working through challenges the best that we can. And as soon as I kind of put a couple of examples out like that, she definitely understood that counseling or mental health isn't because somebody's extremely broken or has mental disorders. It's quite the opposite. It's very common for people to have tough times and then seek somebody to talk to. So that's really what we're trying to do. And it's a great thing for Epic. As I round out this point, it's a great thing for Epic because all of our therapists and all of our providers that do medication management, they're all online. They're able to talk to the kiddos on their laptops and use Zoom. So, we have a broad range of providers that have different specialties and things such as LGBTQ issues or transgender, issues, and not really issues, but people might want to talk about these kind of things, and we have folks that specialize in this. So it's very important to keep in mind that it's more than just something that might be seen as a medical service if something is extremely wrong.
Thank you. That is super helpful. We've got a couple of more questions here. Barbara wants to know, do you work with doctors outside of Epic for students who have anxiety and other issues? And just to be clear, you are not Epic employees. This is a partnership that was created because we've got such a high level of students that were bullied and come from different communities like LGBTQ and such, that we found a need to help or aid in this. And so you are outside of Epic, correct?
Yeah, I'll answer this one and then pass it over to Candy because I think she's got some additional info for you. But that's right. So when the founders and I kind of talked initially, they were thinking maybe they should hire folks to work on staff in Epic. And really, I told them, the healthcare system is very nuanced. There's a lot of details. There's a lot of risk involved for those that aren't familiar with running a healthcare organization. So we agreed that it would be best that Alliance Mental Health would be, the primary provider to Epic Charter Schools because we do understand the healthcare community. We do partner with a whole bunch of other folks, which Candy will speak to. But yes, that's absolutely correct. We are completely separate as far as like an organizational standpoint. We're completely separate from Epic, but a lot of the faculty have our direct numbers. They know me personally and Candy. So, there is a very, very longstanding relationship and a good working relationship with Epic Charter Schools.
Yes, and we do communicate with doctors outside of our agency. So we do offer medication management for Epic students as well as other clients of ours. So we have our own clinic that we do it all through teletherapy. But if a client already has an existing provider that they like, we will communicate with that, and we look at it as a care model, and we do kind of some systems of care, a wraparound model, as some people might know it as previously, and just communicate with all the helping providers within the family.
Excellent. Thank you so much. We've got another question. This one is coming from Lisa Cannon. She wants to know, are there any pointers on coping with stress of ACT prep? And ACT is one of those things that can really get kids, mentally and physically, because they've got colleges that they're trying to get into and plans that they're trying to make. And one test can determine that sometimes. Is there any pointers you can give to our students and families on ACT prep?
That one's kind of hard, especially during this time. Just staying calm and making sure to have some self-care and take some time out of studying for that is a big thing. Just making sure you're taking care of yourself. A lot of times the students will just focus so much on testing and then they psych themselves out for the test. So it's just important to balance the time studying and preparing while also keeping yourself in check with your anxiety.
Good point. I know when I was going through grad school, and I don't know why it took me so long to figure this out, but I went with a reward system. I mean, we do it for little kids. And so I decided that anytime I'd written a paper, I was going to grab a chocolate bar or, go to Brahms or something like that to reward myself for some of that stuff. So finding your way to deal with it is definitely huge. Let me see here. I've got another question from Michelle. And Michelle says, my son needed to talk to a school counselor. I had asked our teacher to reach out for one and never got an email or a phone call. If they did call, I didn't pick up. There was no message left. There's no phone list on the Epic page or direct link to counselors. And I just want to make sure, Michelle, and it sounds like she's got it, but for the rest of the people talking, a school counselor is somebody who's talking about lining up classes and coursework and college. You guys are a different type of counselor and one we've outsourced to. So is there a way to directly get a hold of your company or somebody there where families can get in touch with you?
Yeah, I'll answer this one and then again open it up for Candy. But I just wanted to maybe start on a little bit of a broader picture. So before the pandemic, we were probably getting about 25 referrals a week or something like that, right? New patient referrals. Now we're getting between 200 and 250. We have just been at maximum capacity, and we've hired over 22 new therapists to join the company to help, maintain pace with the volume of referrals that we've been getting. So, I would say that, through that growth, there could potentially have been a piece of communication that was missed, or we weren't able to connect. But what we have are pretty good systems in place right now to double check that we're making sure we call everybody within 24 hours or at least send text messages, emails. And if we're unable to do that, then we go back to the teacher or whoever the person was that referred the student to us. So there's multiple communications that go out, like I said, text, email, voice calls. But I would say the best thing for parents is alliancementalhealth.us. There's a contact us tab, and that email, that contact form goes to the top management team. So you will definitely get a response if you're unsatisfied, if you are frustrated, if the therapist that we've matched you with isn't exactly hitting home with your student. Definitely feel free to reach out. That's why we're here, and that's the best way to communicate directly. However, I would urge that the requests still go through Epic's website, because that allows Epic to track who is actually in services with us and who is not. If you circumvent that and go to our website and submit a referral, that is a way to do it. But again, it just kind of cuts Epic out of the knowledge pool. So feel free to contact us directly, but please do, if you can figure it out, please do request services through the Epic website.
Beautiful. Thank you.
And primarily, yes, primarily we use email when we get a referral from Epic. Karen is typically our receptionist that will email the parents and let them know that we got the referral and check for insurances. If they don't respond to that, she'll give them a call. So it's just very important to check that email that you have registered with Epic, because that's the email that we're going to reach out to the parents with.
Oh, very good information. A lot of times, they use an email address that they don't check very often. So that really is handy. Just so you guys know, Lisa wants you to know that the numbers you're sharing are super interesting, and thank you for sharing. Michelle says her son has no friends in Epic, and he feels like he's the only senior in Stillwater through Epic. So no social connection. He feels alone. How can I help him? Michelle, I'm going to say, if you're not a part of the parent Facebook group, get in there. People are sharing like crazy, and we have a very high volume of students in Stillwater. So maybe we can find some connections. But Candy, how can she help her kiddo who's feeling socially isolated right now?
Well, we've actually just started doing groups. We have a lot of different groups that are starting. We're doing some socialization groups. We're doing some LGBTQ plus groups as well. just reach out to us. If your student isn't necessarily needing the one-on-one counseling, that's okay, because they can still join our group. So we can go ahead and get that started. If you reach out to us, we'll let you know what groups we have. And we do have plenty of seniors and the older seniors that are over the age of 18 that are trying to finish. So we have plenty of groups, and we can definitely get something special started for him around that, and try to find some people that he can communicate with, for sure.
Awesome.
Yeah, if
and
I can
Millie
also interject on that.
Oh, go for it. Yes.
Oh, my apologies. And I did want to also mention that that's a very common feeling right now. And it's not just for the students, it's, it's all of us. And so, also I would say, please normalize that and say that they're not alone. There's a lot of kids out there that are struggling with this. We get that specific request often on our referrals. So, don't feel like your student is the only one feeling like this. And as Candy said, please let us know. We're happy to evolve and customize things. And being in a group of people that are going through similar challenges is super helpful. And it gives them kind of that peer network. So it's not just about, an adult talking to a student. It gives that peer interaction, which is important.
Absolutely, yes. And we've got just a couple of minutes left. Do you offer family counseling? Millie's wanting to know. She sent me a text on the side. Do you offer family counseling?
Yeah, we do. We offer family, we offer groups, we offer social skills, we do case management. We have a lot of things, but yes, family counseling is very, very, very important.
Awesome. Thank you. Okay. So you said something a minute ago, Ron, that again, it sent chills through my body. And I'm just really happy that you're saying, let's normalize this. And I do feel like there's kind of been a push in the last couple of years to normalize mental health. And so that's huge. But we have a ridiculously high volume of suicide and depression rates in our teenagers. And if we are not normalizing keeping the conversation going, then that sucks, honestly. I mean, I grew up with the attitude of walk it off or suck it up, mentally growing up with that attitude, it puts a silo around you. How can we more normalize this conversation, Ron?
Well, I think that you kind of referenced your childhood and growing up, and we are evolving. I would say that it starts with the adults. It starts with the faculty. I mean, if we expect the kids to come to us all the time when they're having a problem, we're not going to catch all of them. And I'll be honest with you, the majority of the referrals that we receive, the kids are not already in services. I mean, and so if you think about that, the hundreds and now thousands that we've received since the beginning of the school year, these are kids that aren't talking to anybody. And so, getting back to the point of everybody really has to normalize it. As parents, it's teachers, it's, it's society. And I think we're getting there. The stigma is definitely a lot less than when we were school-age children, but I think that that's important. And while I have the mic, I did want to make sure I clarified. Earlier we talked about insurance, but we take everybody in Epic regardless. If they don't have insurance, we still see them for free. So I did want to make sure that was clear. You do not have to have insurance at all. I just wanted to clarify that with our arrangement with Epic, we do try to seek reimbursement outside of the state funds if they have insurance coverage. So sorry for diverging there on that point, but I just wanted to clarify.
I love that you diverged on that point, because I'm sure somebody else would have asked. You two, before I let you go, and I want to be, cognizant of your time and honor your time, but Serena says, this has been a great one. My favorite session so far. Lisa says, yes. Bonnie says, thank you. Tanita said, and I'm just going to leave it here. Tanita said, they saved my daughter from suicide, and I'm so grateful for them helping her out.
Oh my gosh.
Tanita, that is the perfect way to end this session. Thank you so much for opening up and telling us. Ron, Candy, thank you so much for being here. Maybe we can have you on the live chat again soon. Until next time, and next time is going to be December 18th. December 18th is our next live Q&A. We are talking college and career planning at Epic. We want you to come and ask your questions. We've got lots of high schoolers who are trying to plan out their paths and make sure that we're on the right path. So definitely be with us for that conversation. Until then, thank you for making Epic the top place to learn and the top place to work.